Hi, my name is Hunter, and today I will be performing the skill administration of a intradermal medication. For this skill, I have my badge, I've got my school scrubs, no polish, no jewelry, so we'll go ahead and get started. So the first thing we want to do is we want to collect the supplies that we need. So I will be using a syringe, ideally a 29 to 30 gauge half-inch needle with a 1 ml syringe. We have got our medication vial, which is going to be tuberculin purified protein, and the dose is going to be 0.1 ml per dose. We've got gauze pads, alcohol prep pad, and then we've got our gloves and then our patient. So the first thing we want to do is we want to collect our supplies, verify the patient's, verify the prescriber's order, and then we want to move into our patient or our 6 rights of medication administration. So right patient, right drug, right dose, right time, right route, and documentation. After that, we want to go ahead and then verify the medication order to the EHR. So we've done that, or the MAR, EHR or MAR. So we've done that. We're good there. And again, it's going to be tuberculin purified protein, 0.1 ml, 1 dose. So after that, we're going to take our supplies, go to the patient's room, enter the patient's room, shut the door behind us to ensure patient privacy, perform our hand hygiene, introduce ourselves to the patient. Hi, Mrs. Smith, I'm Hunter, I will be your nurse. Can you go ahead and verify your first and last name and your date of birth? And doing this, we would certainly verify their identity with their armband using 2 patient identifiers. Then we would want to ask the patient, Mrs. Smith, do you have any allergies? No? Okay, great. So then we would move into explaining why we're here. Mrs. Smith, I'm here because your prescriber has ordered a TB test, which is a tuberculin test to identify whether or not you've been exposed or you have TB. And then we would want to talk about the mechanisms, the side effects, and then the adverse effects. So Mrs. Smith, we would discuss that with the patient. So the TB test is going to, the mechanism is to cause a delayed hypersensitivity skin reaction to TB to, again, help us identify whether or not, 1, you've been exposed to it, or 2, you have tuberculosis or TB. And then we would talk about the side effects of the medication. Mrs. Smith, so some of the side effects, the more common ones are going to be itching and swelling. The adverse effects are going to be shortness of breath, a rash, and or a fever. So if you would develop any of those, you please let us know so we can notify the provider as soon as possible. I did want to note that you might experience a little bit of burning or stinging as we administer the medication, and that's completely normal. So from here, we would then perform our hand hygiene, okay, and then we will go ahead and put our gloves on, right, and then we are going to we are now going to draw up the medication. We're going to draw up the medication, and then we are going to administer it. So we'll draw it up, we'll verify it again, and then we will we'll draw it up, verify it again. Okay, I'm just gonna perform. So we've got our syringe here. Okay. So again, we want to verify the medication again one more time to the MAR and our dose. So again, 0.1 ml, single dose. So what we are going to do, we always want to allow our patient to ask questions too. So when I'm done explaining medication, side effects, adverse, we certainly would ask her if she had any other questions. So I did miss that. Okay, so we're going to go ahead and get started. So first things first is we're going to alcohol prep the top of the vial. Okay, we're going to do this. Great. And then we're going to, first with the cap still on, we're going to draw up to the doses, and we're going to administer 0.1 ml of air into our medication vial. Okay. Can I see it? Okay. Right. So then we are going to get our medication. We're going to inject the air, and then we're going to invert. And now we're going to check for any air bubbles, and we can tap the syringe and push the plunger back up if we do have air bubbles. So tap and then pushing the plunger back in. Sometimes you have to inject the medication back in completely, but this looks pretty perfect. So I'm going to set this over here, and then we are going to scoop method with the needle top here, because again we're going to verify the medication dose, but we're also going to assess the location that we are going to inject for the patient. So next we want to identify the location. So it's going to be 3 to 4 fingers from the 3 to 4 fingers below the antecubital space, and one hand width above the wrist. So we're going to do it, it'd be about here. So we're going to do it about here on the patient. Now I haven't sanitized that, so it's okay for me to touch. Next, we're going to go ahead and sanitize the site. Okay, and we're going to do it starting in the middle, working our way out 2 inches. Okay, and we're going to dispose. And we never want to touch the site once it's been sanitized. We always want to allow it to dry. We never want to blow on it or anything like that. So again, before we administer the medication, we want to, again, double check the dosage to the MAR HR, make sure that it is the correct dose. Okay, so now that we have identified the site, we're going to go ahead and perform the injection. So with this, we want to make sure that we're holding it like a pencil, kind of. Again, thumb and pointer finger. We want to make sure that we are administering it bevel up. Now, if we don't do it bevel up, we will not be able to create our bleb, and that's what we need in order to get that response, right? So we're going to go ahead and put our thumb here and stretch the skin slightly, and then we're going to go ahead and administer 5 to 15, it's going to be 5 to 15 inch angle to administer the medication. Now, I will say, when I was practicing this, I was administering it, but it was, I feel like in a real life setting, I would not probably go as deep as what I'm going to go on this patient, but in order for me to get the medication administered, I have to go probably further than that. But we want to when we are administering a intradermal medication, we want to make sure that it's a depth of 3 millimeters, but we're going to do it at a 5 to 15 inch angle. So I'm going to go ahead and pull the skin taut a little bit here, and we're going to, again, make sure that we're using the appropriate placement for fingers. Okay. Okay, and then we're going to slowly administer the medication. All right. And then we want to make sure that we can see a 6 to 10 millimeter bleb, what resembles a mosquito bite. So I'm going to go ahead and dispose of this immediately. And then I'm going to go ahead and place the gauze over the top gently. Again, we're never going to massage it or push on it aggressively. And then we will hold it for a second here. And then once we are okay with removing this, we would check for any bleeding and see if there was any Band-Aid necessary, which in this case there's not. So what we'll do from here is we will go ahead and remove our gloves. perform our hand hygiene, make sure our patient is okay, and then we would document the procedure.